Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, public corruption in Harrisburg, guess what? We're going to have a little review of these public corruption charges that have been made, successful prosecutions against state lawmakers, and then Dr. Jay Feldstein is in the house for a health care update. All of that, guess what? It follows these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, within the past week or so, we've had, one former state lawmaker from Lackawanna County, former Senator Bob Mello. He pled out to charges. We're going to talk about that. We have another state senator, Jane Orey, who faces, by the way, her sentencing in a couple of weeks. We thought it would be a great time to do a little review, and there's nobody better to do that than Robert Swift. He's with Times-Shamrock newspapers, a frequent guest, and Brad Bumsted from the Pittsburgh Tribune-Review. Brad, by the way, has a book, an e-book coming out, which Robert and I have had the pleasure of doing some work with. Pennsylvania Politics, Corruption Eruption. What kind of a title is that, Brad Bumsted? I love that.
Well, it's a working title, but it does explain how these things erupt. It's nothing new. We've had periods throughout Pennsylvania history where there will be big public announcements of corruption, and then it'll quiet down for a few years, and then it'll come up again. And it's just cyclical.
But we've never had anything quite like this.
No, we haven't.
And I mean, Robert, both you and Brad, you're the veteran correspondents in Harrisburg. You spent a lot of time. Brad, let me continue with you. 25 people in the so-called bonus gate, staffers, lawmakers, ex-lawmakers, but do I got this right? 7 leaders
Yes.
of the state legislature prosecuted and convicted within 4 years? Do I got that right or wrong?
Prosecuted and convicted within 2 years since 2010.
Serious?
Vion's trial was first, and that was in 2010. Yes, we have 7, and the latter 2 that you mentioned, Mello and Orey, are likely to go to prison. It's not guaranteed, but they're likely to. If they do, we'll have 7 former leaders in prison at the same time, and that is unprecedented.
You can't make that up. No. I mean, you can't. All right, let's talk about some of these individually. Robert Mello, leader of the Democrats in the Senate for, since before the fall of the Roman Empire, I think. He served that long, right, Robert?
Right. He was basically, since the late 1980s, he was the floor leader. He pled guilty this week to federal counts of conspiracy. One was to defraud the United States. That involved using Senate staffers to do political fundraisers. Up in the federal documents, say up to the day he left office in November 2010.
Yeah.
And another one was a charge of underreporting income tax, federal income tax in 2008.
Now he's prosecuted by the federal government,
attorney.
Not by state government.
That's correct.
Now the bonus gate, 25 folks were prosecuted by state government, right?
That's correct. And you have one other element in there. The Allegheny County District Attorney's Office prosecuted Orey.
And I want to get back to a feature of that in a moment. So we've got Mello. He pleads out a week or so ago. That is done. We've got one other state senator up there, former state senator Ray Musto. Where does that all stand?
A federal judge is going to be looking, once again, that's a federal charges too, relating to him, whether he's competent to stand trial. So that's where the Musto case is at.
But there are allegations there that are floating around, correct?
He's been formally charged.
He's been formally charged.
Once again, that happened.
Public corruption
right
again?
at the time he retired in
Bribery?
2010.
Yeah. All right, I want to go back to State Senator Orey. There's something happening there unprecedented. Now, because of the way we're taping this, we won't know the results of it, but typically, state senators in the past have used state money to defend themselves and campaign money, and neither the federal government nor state government officials have asked to have that returned.
But now the Allegheny County District Attorney's Office is seeking restitution of $1.2 million in legal fees that the Senate paid, they say, for Orey's defense. The Senate, I believe, will argue that a large portion of that was defending the Senate Republican caucus, not Orey per se, and that only 300,000 of that was actually Ori. But, you know, sorting that all out is going to be the difficult part.
We're going to run to a break. When I come back, one of the things is, I mean, there's the question, should this be done? I guess the question comes up to the time they're charged.
That's
they
right.
can use that money. That's right.
Yes.
But after they're charged, then they can use campaign money. And should they be able to use campaign money? So it gets, but I'll tell you, this is an unprecedented number. Both of you have been around. You've covered this stuff for a long time. I don't remember this number. I mean, 7 leaders of the Pennsylvania legislature in prison, potentially, at the same time.
5 right now.
5 right now. You can't make this up. And we're not making it up. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. We're talking about public corruption, particularly all of these charges that have been leveled in the last 4 or 5 years against a variety of lawmakers. Robert, you make a good point about the longevity of these folks, these leaders, and the impact that they've had on Pennsylvania government in terms of the legislation.
You know, a lot of these leaders were in power for long periods of time. They built the power starting in the 80s into basically mid-2005. Temple University did a study of some of the top-ranking laws, the gambling law in terms of impact.
Gambling law, right.
Whether you like them or not, the children's health insurance, and their fingerprints are over them.
Yep.
Yet the public as a whole in Pennsylvania really don't know who they are.
Right.
Their constituents have known who they were, but they had this vast power given them by the caucuses, the rank-and-file lawmakers.
Yeah.
And, you know,
So these are very powerful people who've run afoul of the law in one way or another, right?
Yep.
Now, look, Brad, one of the reasons why there's this trouble for so many of these folks is the power, the political power that, not just legislative power, but the political power that accumulated in the 4 caucuses to find candidates, to run campaigns. That's an evolution that occurred literally within the last 20 or 30 years, right?
Right, with the decline of power in the counties, with the county chairman. It increased in the caucus, as a point you've made. But what the thread that we see through most of these state-related cases, Fumo's a little different, is a desire for power and continuing to keep the majority where you set the agenda. Yeah. And it has not been, for the most part, money in their pockets. So when they say a theft of $1.2 million, it's theft of state money for campaign services.
So basically, Robert, what this is about is they've been using these resources, staffers and all kinds of time that folks have used, state time to campaign, so they can hold on to their power in order to, pass laws, but not primarily to enrich themselves for the most part.
I mean, somehow
I'm not justifying. It's not a justification.
John Brazell, I think, wanted to run for governor and had plans to run for statewide office too. Some of them. So that was part of it. But mostly it was a lure for power, lure of using the new technology that came along, computers, in the case of the...
So it's more about power per se than enriching themselves, by using this money personally. Not that they use this money personally, they use state dollars to send people out to campaign, to use the computer equipment, to hire all sorts of people
For the most part, that's true.
There are exceptions, but...
Yeah, and even in the Purcell case, but RB is absolutely right. That was the thrust of the Purcell case, but he had a little deal on the side that he was trying to get started called Greystone with Brian Presky, his former aide, where they were going to try to make money off of the stuff they bought with tax money, but it never really developed.
All right.
Musto involves bribery.
I get it. Now, let's go... Brad talked about the cyclical nature of all this. Is the cycle done?
No, and part of the problem is Pennsylvania has weak laws on the books, ethics and public corruption laws. The laws that have been used to prosecute these people were sort of cobbled together, and then the response of the General Assembly has been to write, chamber rules that they self-police. And so if you have a weak...
And they're not very good at...
Right.
How about this question? Has either chamber censured or in some way disciplined any of these members who have been charged in the recent decade? Censured them or disciplined them in some way? They haven't, have they?
No.
Well, no, primarily because the courts took care of them.
Yeah, but shouldn't there be some motion or some sense out of the legislature?
I'd go for that, yeah. That would make sense.
But they don't do it.
In the case of Senator Mello, there were ethics complaints filed against them to the Senate Ethics Committee. They were dismissed on technicalities.
Yeah.
It could serve a function of getting people out earlier before the legal cases drag on if they were serious about it and censured people for ethics violations.
One other point before I let you go. We sit back and we're kind of amazed that state dollars can be used to defend these folks, and maybe we understand that they're defending the institution or the caucus before the charges. But the one that's really tough to get a grip on is use of campaign dollars. The state election code says that these monies can be used. Let's say hypothetically, we don't contribute to candidates, but let's say we did. They can use that money to influence an election. How is paying for a lawyer in a criminal or civil case influencing an election?
Well, it's not. And
Okay.
There was an instance came up where the House Democratic Campaign Committee paid back Mike Vion's loans, and the issue was, how's that in furtherance of an election? And the explanation that was given to me was, well, maybe he'll come back and run again.
Yeah, but that...
I know, it's...
Do you agree that that's well beyond the meaning and the scope of that provision in the election code, Robert?
Right, and there's two cases involving, Senator Ori and Senator Mello where this has been done recently, and that there have been complaints, once again, filed with the Department of State, but that's all confidential as to whether it's been...
See, there's another area, and we're going to end on this, we're going to do our healthcare update, that it's hard to understand why that part of it is permitted when no one expected that money, and the election code is clear, influence an election.
And inquiries into it ought to be open.
Absolutely. All right, great update. All right, Jay Feldstein is here. We're going to have a little healthcare update, our continuing series on healthcare issues. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, we're going to shift gears. We're doing this continuing series on healthcare. I'll get that out, which we're trying to make sure people understand the implications of the changes that are taking place in healthcare. We've got, of course, the Supreme Court case, which in June we're likely to hear from the Supreme Court about the mandate, other aspects of what's known as the Affordable Health Care Act. Joining me is Dr. Jay Feldstein. He's the Regional President, Northern Division of AmeriHealth Mercy, and been on the program before. I want to talk about this impact on Medicaid. I think it's huge, and the relationship between Medicare and Medicaid and how that all fits. But before that, potentially the Supreme Court's decision here can have just a huge impact on what you do, right?
That's correct.
Healthcare.
In Pennsylvania alone, if the Supreme Court upholds it, there'll be an additional 800,000 people eligible for Medicaid in Pennsylvania.
How's that going to be paid for? Is that the
federal government
questions?
for the first 2 years will pay 100%, and then 90%, and then gradually the amount they'll contribute will wind down.
Yeah. So in other words, the purpose of the law is to include a lot of people who aren't covered in hopes that the mandate, which means you got to buy health care, the fine, people will get on a health care plan, or you'll pay a fine, and some of that money will be, also they're taking money from Medicare.
Correct.
To pay for it. It's all complicated.
It's very complicated, but the idea is at the end that if everyone's insured, eventually everyone's costs come down.
I get it.
Because people are in care earlier, they're getting better care earlier, so their health outcomes and their long-term costs from chronic disease are reduced.
I get it. So the more people see a physician, the more they end up in a facility getting care, the less likely in the long run it is to drive up medical costs.
Correct.
But we also have the other problem, and it's a pretty serious one, of shortage of doctors. All this fits in, and whether people can get the treatment. I mean, the healthcare is going to undergo changes in the next 20 years, the likes of which we maybe have never seen. Now, you're the
right,
expert.
Terry.
You tell me.
Right.
You're the expert.
So we've got to put things in place for increased access. We've got to have more primary care physicians. We're changing the model in Medicaid and in healthcare in general of the medical home to have care coordination be a big portion of medical care in the primary care office, and actually, try and improve outcomes and coordinate the care, because there's so many gaps in what are called transitions in care, and that's what we do in managed care, to coordinate the care.
And the hospitals, as we talked about before, required to take patients whether they have insurance or not, and they often seeing patients who haven't been treated by a physician, and then they have to get all kinds of acute and other kinds of care, driving up costs all along the path, right?
So, if people come in untreated, their care is more expensive.
All right, well, let's specifically go to how this recession in particularly has changed the face of healthcare, something I know that you know a lot about.
Well, it's really changed the face of Medicaid, because for every 1% increase in unemployment, there's 1 million people then become eligible for Medicaid. So whatever stereotypes people had about the face of Medicaid, inner city minorities, everyone is in Medicaid. 60% of Medicaid beneficiaries are women and children, frail, elderly, the disabled, people without a voice. So managed care companies, we're really the voice for those individuals.
Yeah, well, I'm glad you brought that up, because I think that's a point that has not been sufficiently made, the changing nature of who's covered by Medicaid. I think, it's just, a certain kind of person. It's not anymore, and that's your big point, right?
It's everybody. I mean, people that were employed in the construction industry, when they're out of work, and their job benefits, their bank, they become Medicaid eligible.
Yeah.
So we're seeing more and more people that were formerly employed in Medicaid.
All right, we're going to run to a break. When we come back, I want to talk about specifically how programs such as the kind you run have tried to fill the gap and assist people in this process. We'll be back following these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business, with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back to, we're doing a healthcare update. Doctor, talk a little bit about how, what AmeriHealth Mercy family of companies does in relationship to helping people access health care.
Well, we're a Medicaid company. We're a national company, but our largest presence and our corporate headquarters is in Pennsylvania. We insure 400,000 Medicaid members. And what we really try and do is to outreach to our members to improve the access to care, to remind them to get mammograms, preventive services, individuals with chronic diseases, to make sure they take their medications, to make sure they get to their doctor's appointment, everything we can do to increase the quality of the care by increasing access and coordinating their care so that the primary care and the specialist and the hospital know what everybody's doing.
And as you point out, by doing that, in the long run, that creates more efficiency. It's not only good for the patient, but it's good for the system.
Correct.
Let's talk about another. How is that different from most social services?
Well, what differentiates us from other social services, we're a risk business. We're an insurance company. So we're highly regulated by the Department of Insurance, and we have certain actuarial financial guidelines that we have to meet. So in terms of rates that we get from the state, they have to be actuarially sound from an insurance perspective.
So that makes you different. I mean, you're not a direct provider, is what
Correct.
is your
We're
point.
an agent of the state.
You're an agent of the state. Okay, now let's look ahead a little bit. Where do you see all this going? What's in your crystal ball? I mean, the big question I always have is 75 million people eligible for Medicare, huge cost there. The relationship between Medicare and Medicaid is well known. You know, some folks in the federal government, the president wants to shift, take some Medicare money, put it in Medicaid. I mean, where does all this go? I mean, if you had 3 or 4 things you would say in your crystal ball, what would you say to the President of the United States and the Congress about what they should do?
Well, the first step would be to coordinate the care for what are known as the dual eligibles. Those are individuals over the age of 65 that are eligible for Medicare and Medicaid.
Got it.
That basically operate in silos. They are 40% of the cost in Medicaid, although just being about 20% of the population. We've got to coordinate their care. There's tremendous amounts of dollars being spent in silos without coordinating that care.
I got it.
We've got to combine those programs
Right.
to drive better outcomes and get efficiencies in the system.
Yeah, that's the first time I've heard that point, by the way. Go ahead. Give me another idea.
I also think that we've got to make managed care more prevalent in other states because we do a better job of driving clinical outcomes and quality as opposed to fee-for-service programs.
Right.
And that'll also help to take costs out of the system and to improve the quality.
Okay. Now, how big an impact, we have about a minute to go, how big an impact do you think this Supreme Court decision is going to have on long-term health care?
I think it's going to have a huge impact, and one way or the other.
Can it survive without the mandate? Everybody knows a mandate that you have to buy coverage and be done through insurance exchanges. We've been into the details of this before, but the fact is, can it survive without the mandate?
I don't think it can survive in its current form without the mandate, but I think we'll see another version if that gets voted out.
Yeah. We got about 35 seconds left, but most people like lots of features of it, like coverage for the kids and don't kick people off for pre-existing conditions. That stuff is going to remain in one form.
And that's already priced in, quite frankly, in the commercial health care world.
So regardless of what happens to the mandate, that essentially will be done by the insurance market in one way or another, would you think?
Yes.
All right. Look, I want to thank, great update. We're all looking forward to this big Supreme Court decision that could be a game changer for most of us. All right, thanks for watching this edition of Pennsylvania Newsmakers, and as always, stay well.